Okay, my name is Bobby Choi. I'm Chief Strategy Officer of Culane Healthcare. It's a subsidiary of LG CNS. LG, you may have heard, is getting into the senior healthcare space. We're doing quite a bit in the EHR arena. So we have long-term post-acute care EHRs. We have telemedicine systems. We have a continuum of care suite. And we've all developed this during the modern healthcare reform era. So what we'd like to see is how do we apply this in innovative care models? Our CEO and our leadership come from a physician, long-term care, operations, and population health management background. So we've been there, we've kind of been in this driver's seat, as you would in the physician world, but we've also had operators give us a lot of input in what our systems will do in terms of care transitions. So when we look at patient-centered care, again, with a lot of leadership coming from the physician space and from the population health risk-bearing organization space, we look at patient-centered medical homes and chronic care management, transitional care management protocols for how do we leverage technology not just to digitize current workflows, but how do we adapt to innovative care models. So integrated service delivery, whether you have all the service lines or not, or whether you create your own narrow networks within the physician, the hospital arenas and the payer sources, we do believe a lot in mobile care teams. So our product, our telemedicine and consumer-based product is called the Interactive Virtual Care Team. So we want to engage not just patients, but also family members, informal caregivers, and then these more innovative care models that we see emerging, like community paramedics. And I'm not sure if you guys have those in your communities, but we see them popping up everywhere in Texas, for example. If we go back one slide, we look at telemedicine not just as a traditional way of doing remote patient monitoring, vital signs measurement, the way we've seen it in the past, but also using it as a warm touch for transitions going into a facility or going into home health. So applying the apps, and we have mobile apps for any kind of platform, whether it's iOS or Android, being able to deploy these in a rapid and massively scalable fashion just through app deployment to any device so that a patient and their family can monitor themselves before needing to go into a care setting. And we can also do video visits to make patients familiar and more comfortable with what care setting they're going into, what kind of care teams they're going to encounter. And so during the whole process of post-acute or long-term care, if there's a discharge or a transition that happens afterwards, being able to use the telemedicine tool as an additional follow-up surveillance and reminder system. So we have video visits, medication management, we have your personal health record that follows you. All the vital signs that you typically measure can be connected through Bluetooth devices or self-measurement. We have voice recognition, facial recognition. Just about any technology tool and innovation we put into one application for an all-in-one telemedicine solution. So when you think about where we used to have to go to multiple different apps for vital signs measurement, video visits, medication management, even the larger health plans are using multiple different apps. We put everything into one platform and we integrated it back to our electronic health record system. So we can monitor data graphically, visually. If something happens, we can initiate a secure video visit back to the patient or provider. And also do other innovative things that nobody has really done in the video visit space. We have a lot of WebEx functionality. So we can do screen sharing, we can do whiteboarding, we can share what's going on with the patient's information and talk to specialists for consultations or back to a family member to illustrate what's going on with the patient. This goes back to the surveillance aspect. When I look at operators that are trying to initiate their service line at the right time in the right place, the data elements certainly help in trying to drive the patient to make that decision. Say, it's the right time to enter our assisted living facility. It's the right time to start hospice. It's the right time to start private duty home health. And a lot of those elements come with having a real honest conversation with family members, with patients' families, and patients themselves, and say, this is the real data that we've been tracking. The Internet of Things team we've just launched. If you go to the Idea House, you'll see multiple point of care testing devices that are wireless, but also our LG appliances. So the Internet of Things team will be wiring those up or rather wirelessly wiring these things up so that we can incorporate that data on top of all the other things that we capture, medication management, compliance, adherence, and then also the vital signs. Now, we also have some innovative partners that we integrate to, nurse call systems, wearables. So all that additional data that we collect, we'll use for advanced analytics to make better decisions of when to start care, how long it should last, what care setting is appropriate, and for payers and for risk-bearing organizations.